Welcome to Healthcare Upside Down with your host, Dr. Nick Vanterhaden, and brought to you by ECG Management Consultants. You can learn more about the show on the program's page at healthcarenowradio.com or on our blog at ecgmc.com/HUD. The U.S. spends more on healthcare per capita than any other country on the planet. So why don't we have superior outcomes? Why haven't the principles of capitalism prevailed? And why do American consumers have so much trouble accessing and paying for healthcare? Each week, Healthcare Upside Down will dive into these and other issues with ECG principal Dr. Nick and guest panelists as they discuss the upsides and downsides of healthcare in the US and how to make the system work for everyone. And we end with your better pill to swallow, the conclusion to today's episode with insights on challenges and changes that improve healthcare. Now here's your host, Dr. Nick.
Many years ago, I had the fortune of being involved in what was a once-in-a-lifetime opportunity, building a brand new independent hospital from the ground up. The project started as an empty field and ended up as a 250-bed hospital with 21 operating rooms, 2 CT scanners, 2 MRI scanners, and included the capability to install an intraoperative MRI, something that was not even available at the time, but we were building to future-proof the facility. We even added a large hotel to the complex, something that was unheard of at the time, but represented an essential component of the full care facility designed to treat patients from around the world. The project was not without its challenges, the prime of which was the complete distrust and dislike by the local community of the concept and what the project stood for at the time. Despite all the challenges, we opened the facility 3 months ahead of schedule and under budget, something that was almost unheard of in healthcare, let alone in construction in general. To this day, the lessons learned from that experience continue to be applied to my work. Despite taking place several years ago, the insights continue to help shape my thinking and the way I approach healthcare delivery for the benefit of the ultimate customer, the patient. This may seem basic or perhaps obvious, but based on many experiences in healthcare, does not seem to be widely adopted or implemented. This may be the result of the move to larger healthcare systems and the challenge of keeping things personal as organizations grow in size. For some patients, these large facilities represent a good choice, but for many around the country, access can be challenging because of geography and distance. As we've heard in previous episodes, the local hospital and healthcare facility remains a central and important part of every community. Because of the many challenges of rural health and the systems in place, keeping the doors open is an ongoing struggle, but one that is essential for those communities and offers some useful insights to everyone else in the business of healthcare. Join me on the Healthcare Upside Down show as I talk with Dr. David Klein, a general surgeon who's expanded his role to run a number of healthcare facilities and is currently the Chief Executive Officer of Marin Health, a California independent hospital north of San Francisco. Hi, David. Welcome to the show.
Thanks, Nick. I'm glad to be here. Thanks for having me.
So you're running an independent healthcare system, but as we look around, certainly the United States, and perhaps it goes broader than that, independent healthcare seems to be a dying breed. We're losing those systems. Should we be worried, or should we be celebrating it and looking to these large consolidated systems as the future of healthcare?
Yeah, I would not be worried. I think that there still is a role for independent market-based healthcare systems. In my career, I've had the opportunity to work for very large companies, some of the biggest on the for-profit and not-for-profit side. And in my current position, we are a community hospital. We are a strong community hospital. In fact, we're thriving right now in a post-COVID era where I think some of the larger systems are struggling. And, you know, the honest truth is that healthcare is really local. And one of the things that I noticed being part of the larger healthcare systems is that they would sacrifice a few for the many, and they weren't quite as focused geographically on the specific needs of a community versus looking at the entire corpus of the system. And so one of the things that I've enjoyed in my current role is that we focus on our community. We meet the needs of the community. We provide the services our community needs. We can be invested in every aspect of the community and every part of it so that we provide the appropriate care to all aspects of the community and the region. And I think that makes a difference. I think the other part of it that's really important, and one of the things that has always appealed to me, is just our ability to truly be nimble, make decisions on the fly, based on what our current needs are. And it could be on decisions on how we spend capital. It could be decisions on adding service lines, taking away service lines, meeting the needs of a subsegment of the community, which I can decide along with the team and the board. We can decide at a moment's notice, versus when I was with the larger systems, and it took sometimes an act of Congress, if you will, to get major initiatives done. So I think we're here to stay. And I think we provide an invaluable service to the community that we serve, with the provision that we do need to, in order to be successful and to be able to meet financial needs, et cetera, I do think partnerships are essential for us. And in our case, we have a strong academic partnership with UCSF.
So if we accept the notion that healthcare is local, I think, provides not just healthcare, but, center of community contribution. You're in a slightly different circumstance to some of the other rural systems that I've spoken to, where, the challenges that they faced have been about the level of ruralness and the challenge of getting people in because of distance and, those contributors. But in your case, you have some different drivers because you're in a relatively expensive area, which essentially makes it very difficult, I would imagine, to attract and retain staff. How do you approach that particular problem?
Well, it is complicated. I think we're not alone across the nation in having a real struggle with labor shortages. I think post-pandemic, everybody's heard about all the resignations and people moving in different careers. Add to that the significant expense of living in this part of California, in this part of the country. It is one of the most expensive regions, literally, in the country. And so keeping and maintaining staff, remember, we're just across the bridge from a number of large medical complexes that are also fighting for the same employees. I think we attract the type of people that really do want to be involved in a community-based organization. I think we try to remain competitive with the things that employees are looking for, whether it's salary, work style, where they work, how they get to work, how they commute, et cetera. And we also, I think, because we are independent, are able to offer some flexibility in work schedules. And I think it's what we try to build is really sort of a family type of an environment where people really feel part of the team and they really do feel that they make an impact on the care that we provide. Also, being part of a smaller hospital, their input is valued. And as we build the culture of the organization, I think people really want to feel valued and they want to be heard and they want to be a part of a lot of the decisions that are made. So I think our culture is just that every person in the organization is important. We have a very flat leadership curve. All the leaders of this organization are out and about. And I tell the staff in general that they don't work for me, I work for them. And I'm always looking for ways to eliminate barriers, to make their job easier, to really try to stem things that we're seeing, such as burnout and those types of things. So I think that's appealing when we look to attract employees. And we've done a pretty good job. We are short and we do have to rely on premium labor. But I think by comparison, I think we've done actually pretty well over the past couple of years.
So I think one of the things that strikes me, and you talked about this in the first part of the conversation, the connection with academic centers. And, one of the pushbacks that we hear about rural or independent is, am I getting the best that I possibly can? Clearly having those links and providing, I don't want to say an extension that would offer a disservice to you, but certainly by extension and by relationship help sort of validate that. But that can be quite difficult to navigate. Is your success in doing this partly attributable to your medical background?
I think certainly that has helped me as I made the transition from full-time practice into hospital management, having the ability to have those open conversations and having walked in the shoes, if you will. And really my primary focus where I start with the patient first, quality and safety, and build from there. I think that definitely has been a benefit for me. I think it's also helpful as I reach out to some of our academic partners and have more in-depth clinical discussions about the needs of our particular patients. I think it's worked really well. I think the best types of hospitals really, and I've run other hospitals that have had strong academic affiliation, are exactly that: a community hospital that can provide broad spectrum care with a partnership in an academic center. And the goal always has to be that keep everything in the community that you can. And if it's something that we aren't able to take care of, we have an easy route to transfer patients. And the other beauty of it is that just particularly as an independent system, we would have difficulty recruiting some of the types of specialists and surgeons that we need. And I think about neurosurgery, cardiothoracic surgery, some of those more advanced specialties that probably wouldn't come to our organization if it were not for our academic affiliation. So I think having been still I'm a physician, but having started in that direction, I think it has helped to strengthen our ability to work with an academic partner.
So the other thing that sort of strikes me as part of your background that maybe contributes is having worked in the larger systems, you've got that experience. I'm curious about why you moved. I mean, lots of people enjoy that environment. What drove you and what attracted you to this?
Yeah, I think I've really had a great career and great experience both on the for-profit and not-for-profit side, mainly with large systems. But I think with me, there was always an ambient level of frustration of how long it took to get things done. And as I mentioned earlier, the focus of the larger companies being on the greater good, if you will, and me always feeling that the needs of the community that I was serving, I wanted to advocate for that and make sure that they were served. And I think sometimes, as we know, there's limited capital and there's not sometimes a lot of cash to go around. I sometimes felt like I maybe wasn't getting quite a fair shake. And so what appealed to me about Marin Health in particular was knowing that everything that we do, everything that we make, we're a not-for-profit, either goes to rebuild the hospital, help us to hire labor, buy new equipment, or it goes right back in the community. We provide a tremendous amount of community support. And the other part of it is that part of the joy of my job is interacting with the community, all the sectors of businesses, being out there, talking to folks, seeing what their needs are, participating in larger decisions that can impact me because I live in the community, my friends, family, and others, and making sure that we are positioned to do not only the best that we can, but what's expected of us. So I think I wouldn't say that doesn't exist in a larger system, but I would say that it helps to bring me closer to the community that I serve, and knowing that our resources and of course any profits that we have are going to stay in the community as well.
So one of the primary challenges we hear repeatedly, and I know this is for the most part universal in healthcare, but I think more acute in the rural or independent healthcare setting, is finances. Mm-hmm. You're struggling against a system that for the most part is tilted to not pay out, right. Pay out insufficiently. And, at varying levels and depending on your case mix, you're going to see different costs. How have you approached that? How do you successfully manage that and remain financially fluid?
Right. Well, it's the balance between cost and revenue, not to be ridiculously simple about it. But we've actually been able to fare pretty well for a number of reasons. We've been able to expand regionally into the North Bay, into markets where we see growing populations. But strictly on the revenue side, it's very volume obviously cures all ills. And but also our ability to negotiate with payers because we are in a unique position in the market, and I do believe our partnership helps us in some respects as we work to achieve contracts that are appropriate. I think building strategic service lines, following our strategy and making sure that we're very customer focused and that we really meet the needs that are available. Stemming out migration is always a big issue because folks can drive just across a short short bridge to get into a community where there's literally hundreds of healthcare providers. So putting a good product out there, achieving high patient experience, treating our physicians as partners so that they want to use our facility, being the easiest and best hospital for our physicians to utilize, always makes a big difference. It also helps that we have a growing medical network that works closely with our hospital and the services that we provide. So really on the revenue side, it comes down to our ability to really put a good product out there, grow the service line, expand geographically, have some other downstream revenue opportunities in a diversification strategy. And then on the cost side, all of our costs really, almost 60% is in and around our labor, which is going up astronomically. Obviously, other supplies, pharmaceuticals are drastically increasing. So maintaining our costs, making sure that we're focused on the patient. Really what drives healthcare is the provider-patient relationship and making sure that we're doing the right thing. So being operationally efficient, making sure that we're also clinically efficient, doing the right things for the patients, making sure that we have good standardized processes, and eliminating all non-beneficial variation. So I think putting those two together, we've actually been quite fortunate with how our organization's been able to do, post-pandemic, where everybody suffered significant losses.
So I just want to tell you, I have lived in the Bay Area. I think you underestimate the difficulty of driving across the bridge to get care, right?
Depends on the day and the
just
time.
Personal experience. So
Right.
maybe some attraction to localized care that, is as high quality that, that aside, aspects of this is the financial competitiveness that keeps you or keeps patients locally. Is the fact that you're not for profit a big contributor to this?
I don't know that the patients, as they make a determination about healthcare, really think about for profit or not for profit. I'm not sure they even understand the nuances, but I do think cost is important. And obviously access is convenient. So just on the cost side, the consumers are becoming more and more responsible for their share of the healthcare burden. So assuming that quality always comes in play, but assuming that you have equal quality, they're going to choose an organization that has easier access, whatever that looks like. It could be as simple as parking. It could be as simple as knowing the hours, things like that, that cost them the least. Again, assuming that quality is standard across. And some people think quality is elastic. Some people quality is inelastic. But most consumers assume that if you're an accredited hospital, you're going to have it. So convenience comes into play. And I do think if people feel like you provide the highest level of care, and certainly an academic affiliation aids in that discussion, that the halo effect of that, then they are going to stay local. You usually get one bite of the apple, though, if they don't have a good experience, and never underestimate patient experience, they are likely not to come back. The other part of that is that physicians really drive that interaction, and it's really important that our physicians feel comfortable and confident in the care that we provide, and that we also make their lives easier. Physicians really are looking for control over their environment, obviously respect for what they do, but they want to refer their patients to a provider that provides the highest level of care. And I think Marin Health checks the boxes in every one of those areas.
So as a relatively unique individual, there aren't many people like you who've got, clinical experience, then large healthcare management experience, and now, healthcare independent. As you think across that career, what's your proudest moment as you've entered into this? When you think about not necessarily success, but, real value add to the community.
Yeah, I love my career as a surgeon. I enjoyed the day-to-day interactions. I had success. In fact, was working 18 hours a day, and I really enjoyed it. But one of the things that's really been satisfying for me is just the ability to impact healthcare on a much broader scale. I think back across my journey of the various systems that I've worked for and how I've been able to kind of move through the ranks and really make an important difference in the patient lives that we all have always had the privilege to serve. I would think of one instance where I had the opportunity to build a greenfield hospital. I was in Austin, Texas, working for a not-for-profit, for a for-profit company, and had the ability to move in and oversee the development and building of a brand new hospital, building the medical staff, creating bylaws and policies and procedures, hiring all the working staff, and one day opening the hospital to a community that really didn't have, at least a part of the community, didn't have direct access to healthcare. I would say that was a moment of pride for me. But I think every day, just as I make rounds through the hospital, which I still do, even though I'm not practicing actively, and have the opportunity to meet with patients and see the difference that we make in their lives, it's tremendously rewarding. And in fact, when I speak at our new employer orientation, I always tell our healthcare workers they're in a unique profession where they know when they come in at the start of the day, whenever their shift is, that they're going to make a difference in many people's lives. And at the end of the day, I always invite them to reflect for 30 seconds about how many lives they've touched and what difference they've made. And I've been a servant leader in healthcare my whole life, and I really can't think of anything else that would have been more rewarding than what I'm doing today. And I've seen all aspects of it.
So that strikes me as the sort of the executive overarching principle that you have applied both to your career, but obviously to this facility. You've permeated that through the organization. What's your guidance to others who obviously want to replicate this kind of success, do you think?
I think it's simple. I think it's always put the patient at the center of every decision, no matter what the decision is, whether it's financial, whether it's building, whether it's adding services. If you always keep the patient at the center of every decision, it's always going to be right. And the other thing is always doing the right thing for the right reason. If you ask yourself the question, am I doing this for the right reason? If the answer is no, then you probably need to not do that. The other thing that I would say to others that are in the field, one of the things that I learned early on is that every decision you make has consequences. Some of them are life-saving or life-threatening consequences. And there's many, many different folks that can be impacted by a single decision. I stumbled in a couple times early on by not really thinking about the ramifications of a certain decision, how it might impact all the particular stakeholders. So when I make decisions, I really try to go through this decision tree in my head. Who's it going to impact? Positively, negative? What are the potential outcomes? So I think those three things, just keeping the patient at the center of everything we do, doing the right thing for the right reason, and making sure that you clearly understand the decisions you make, who they're going to impact, who they could hurt, and who they might help. I think that's really been good guidance for me.
Well, you and I share a common experience of a brand new facility, greenfield. In my case, it was what we call brownfield site, because it was dirty and we had to clean it up. But
of course,
similar sort of positive experiences, and I think same principles that we share. Very grateful to have had the opportunity to talk to you and learn a little bit more and share that with others. David, thanks for joining me today.
Yeah, thank you very much. I've really enjoyed the chance to talk to you. Obviously, I have a passion for what I do, and it's great to be able to talk about it. Thank you.
As you heard from David, healthcare is personal, and as such, the decisions we make must be done for the right reasons and can have huge consequences in some very unexpected ways. David's excellent advice jibes with my early experiences building a hospital. The message that permeated everything we did, even rising to our organizational chart at the time, that put the patient at the top of our organizational chart, with everyone else reporting to the patient. Your better pill to swallow is to spend a day in the shoes of the customers you are ultimately serving. No matter who you are, your seniority or level in the organization, spend some time at the point of service in healthcare. I was recently forced to sit and wait for about 15 minutes in a pharmacy and witnessed a procession of people experiencing outright misery and despondency as they tried to navigate a system that did not appear to have them or their needs at the center of their healthcare experience. If we aren't serving or helping the patient with the process, then we should rethink and find better answers. Thanks for joining me, your host, Dr. Nick. on this week's edition of Healthcare Upside Down. Until next week, keep solving the business of healthcare as if your life depended on it, as one day soon it will.
That's all the time we have for today. You can find all of our episodes on your favorite listening platform by searching for Healthcare Now Radio. Also, check out our blog at ecgmc.com/HUD for summaries and commentary from each episode. Follow our show's social hashtag, HCUpsideDown. And join us each week as we work to solve the business of healthcare for everyone.